Immunodeficiency Virus, or HIV, has been a part of medical research efforts for over 40 years. Although there is no cure for HIV, there have been improvements in preventing the transmission of the virus. We're going to talk today with Alvina Chu from the Florida Department of Health in Orange County. She's the director of the Division of Infectious Diseases. HIV, we're still having the conversation. I've noticed the commercials on the air with medications that make someone undetectable, therefore unable to transmit the virus. Have people gotten too comfortable?
So since the peak of the epidemic in the 1980s, we've really had great advancements in treatment and prolonging life. And so we've been able to increase the number of persons who are living with HIV. But the actual number of new cases has remained pretty much steady. And so we still are adding new cases every day.
This statistic blew my mind, and I want to read it. Based on the 2020 HIV surveillance report, the ranking of HIV diagnosis rates by metropolitan areas in the United States, Orlando, which is Orlando, Kissimmee, and Sanford, 5th in the nation. That's crazy when you consider areas that are much more densely populated. How do you combat numbers that high?
Well, specifically in our area, we know that over the last year, there are still health disparities in the diagnoses of HIV. And so we really want to get to populations that are not getting enough testing and not getting enough access to care.
What are those populations?
So about 1/3 of our new cases are in Black or African Americans. Almost nearly half of those are in persons who are Latino or Hispanic. And the majority of those cases are in men who have sex with men.
So have you found that is a trend no matter what metropolitan area we look at? Those most impacted are people of color?
Yes.
Why? I mean, that's the obvious question. Why?
It is. It's multifactorial, I think. So there may be some cultural reasons, or there may be people feel stigma. There's less acceptance, perhaps, in certain communities.
So the stigma is still there. And yet we see, the commercials that we see people of all walks of life. So I'm curious as to the services you provide for the people who say, yeah, I do need to get checked, or I do need to find out what medications are there. So, what does the county do?
Well, so the Florida Department of Health in Orange County is part of the Ryan White system of care, and so we provide comprehensive HIV services for persons who are uninsured. Also persons who are underinsured, and so maybe you have insurance but it doesn't cover everything you might need. We offer testing, and so we have a group that does community testing, specifically trying to get to those places that need more testing. And we've recently started a home testing kits program where you can, in the privacy of your home, order a home test kit, and the results will be sent directly to you and the health department so that we can follow up and get you linked to care.
So how does one find the testing center or get access to the kit?
So we have a website, Talk, Test, Treat, and also the cdc.gov has a comprehensive website for anywhere you are in the United States.
TalkTestTreat.com?
It's Talk Test Central Florida, CFL.com.
Okay. Let's talk about prevention, because we know most sexually transmitted diseases are preventable. What tests, what is available? How do you recommend people start having that conversation?
So really, it's good to have a conversation for your own health and for your partner's health before you engage in sexual activity about, the history, whether or not you've had any previous tests, and maybe the circumstances of multiple partners. So it would be good to know about that. And then if you're unsure, or if you think you might have had an exposure, definitely seek out a test. Initially, HIV infection might have you might have a flu-like symptoms, or you might have an illness that might seem mild or short. But untreated HIV is inevitably fatal because the virus will attack your immune system and leave you open to other infections and also damaged organs.
We haven't talked about that piece as much. I mean, initially when AIDS, HIV, any of those related diseases came on the scene, all we heard about were people dying. So have we become too desensitized?
I think it's possible that the great treatments that we have now that can help you get to viral suppression and help you live longer, maybe that message about the serious consequences of untreated HIV might have been lost. So we really want to promote that treatment is very effective and could be life-saving.
How early should we start having these conversations? Like if we have young people in our lives, and how do you even broach the subject?
Well, certainly if you're going to have a conversation about sex or the potential of sex later on, that's an important conversation to have, not just about, protecting yourself, but also protecting your partners.
And does the county's health department provide information on how to broach that subject?
Certainly, we do. We have material or literature that one could download, as does the CDC, but also we also have counselors and disease investigation specialists who would be able to speak with the person.
Are you finding the numbers growing in a particular age group, or does it kind of span the gamut?
The highest numbers are increasing in sort of the median age is about 35.
Okay.
Yep. So, I mean, the typical or the increase is greatest in men who have sex with men and Black or African American and Latinos.
How big a part do those communities' centers of influence play? The churches, the social gathering places. What are the efforts to educate people in those places where we know people gather?
So we do have outreaches or community outreaches where we partner with with the community to go to those places where people trust, reduce stigma, and encourage testing. And so really engaging community leaders has been an important part of our partnerships in trying to help prevent the HIV epidemic.
Well, we certainly want that number to come down. I mean, Central Florida, we want to be known for a lot of things, and that's not one of them. So thank you, Alvina, for shedding some light on that and letting people know you can't get careless. Thanks for being here.
Thank you.
The goal is to get to 0 transmissions. Knowing your status and taking precautions can prevent the spread of the HIV virus. We'll be right back. Thank you for joining us.